Hello, this is Dr. Ayaz Ahmed. I am working as an aesthetic dermatologist. Today, I will discuss another important topic about the hair loss. The topic of my discussion is androgenic alopecia, its diagnosis, investigation, and management. So, hopefully, you will learn lots of knowledge. So, stay connected and subscribe my YouTube channel. By definition, disorder caused by the genetic mutation and effect of androgenic hormone in our body. Epidemiologically, at an age of about 70 years, 50 to 60% of a man become bald. It's less common in Asian. Japanese develop balding 1 decade later than white people. In Korean, prevalence is 30% lower than with each decades. It is 20 to 40% lower than in a white people. Hamilton and Norwood grading system. Both these describe the balding process of hair in relation with the age. According to them, early balding or early hair loss usually take place in 18 to 29 years of age. Yet about 40% people in this age develop balding. Further 24% of people develop balding at an age of about 30 years. 3% in their 40 years and 5% in their 50 years. 9% in 60 years and 2% in 70 years. And finally 1% in 80 years of age become bald. Female pattern hair loss. Hair loss also happen in women. Yet about 32% develop no evidence of hair loss up to 30 years of age. 3% develop in 29 years, 30% in 49 years, 8% by 69 years, and 6% in 60 years. Ludwig scientists pointed out diffuse reduction of hair loss or hair density over the crown with widening of central parting line. It will be discussed in next slide. Associated disease. So these are the diseases which are usually associated with common baldness or common hair loss in male as well as in female. These are trichodynia or scalp pain, prostate cancer, coronary artery disease, neuromuscular disorder. Most common is the Kennedy disease, hypertension, hyperaldosteronism, and polycystic kidney disease. These all are related with the hair loss. Pathogenesis. James Hamilton described the role of dihydrotestosterone hormone in hair loss. Dihydrotestosterone is a potent metabolite of testosterone hormone. It causes follicular regression and ultimately leads to the male pattern balding. Moreover, mutation of 5-alpha reductase do not cause balding, as seen in a randomized controlled trial. Its expression is confined to the terminal papilla and genital tract. Local hormonal effect. Occipital area or occipital hair maintain resistance to androgenic alopecia. Moreover, prostaglandin D2 and its enzyme are inhibitor of hair growth found in other parts except occipital area. This is the reason that transplantation the selected hair are from occipital region. Hair cycle dynamics. So anagen phase is reduced while telogen, specifically in its late kinogen phase, remain constant or increased. Rate of hair growth is determined by duration of anagen phase, which is reduced in early cycle of androgenic alopecia. Hair follicular miniaturization. It is the transformation of terminal hair follicle to villus type follicle, leads to finer and lighter color hair with small size. Follicle size is determined by the dermal papilla. In androgenic alopecia, the dermal papilla is targeted by the androgen. Elastic staining shows appearance of stele or fibrous tract, or you may say steamer, and aeroperclin bodies in the neck of dermal papilla. Histology: decreased terminal to villus hair ratio of the hair, appearance of stele into bracket fibrous tract or streamer, and lymphohistiocytic infiltration. This is a picture showing different stages of hair follicle. In first picture, the follicles are in telogen phase. In second picture, this shows the follicular miniaturization. Five follicles are there and three are miniaturized. In third picture, the follicle is surrounded by onion color skin, fibrous ring structure around the follicle. And in fourth picture, there are fibrous streamer or fibrous band that are near to the follicle in this picture. Genetics. Polygenetic inheritance have been observed because of involvement of multiple family members. You all know that the androgenic alopecia, once developed in parents, will be seen in offspring in coming future. Two main genes are involved. These are androgenic gene, androgen receptor gene, and EDA2 gene. Genetic variability at androgen receptor and EDA2 locus enhance the androgenic alopecia. Weak association have been noted in a woman. Moreover, estrogen may be involved in female pattern hair loss. Clinical features: and the hairs are very short and less pigmented hair. The person may be socio-psychologically impaired. Features are elaborated by Hamilton, who described male pattern baldness, Norwood aided grading system, that is 3A, 3 vertex, 4, 5, 6 and 7 grading system. Ludwig identified female pattern hair loss in 1977 as a mild frontal baldness and bitemporal recession. No vertex is involved. He gave 3 grades for the female pattern hair loss that will be discussed later on. So these are the 3 grades of Ludwig's. According to him, in grade 1 there is a central widening, or you may say central parting of the hair. You can see in grade 1. In grade 2 there is increase in area in the center of hair loss, and in grade 3 there is extensive hair loss have been noted. This is Norwood classification of androgenic alopecia. According to Norwood, there are 7 grades. You can see from first to 7 grade system. According to Norwood, the scalp area undergo 7 stages of hair loss. So before I proceed to Norwood classification, I would like to first describe the scalp part so that you may have clear concept of hair loss. So the scalp part are: number first, hairline. This is the hairline. You can see extending from this region up to this region. This hairline comprises of frontal tuft, frontotemporal angle, and vertical framing of face by means of temporal triangle. Now you can see in this picture, this is the top view and this is the lateral view. In this lateral view, you can see this is frontal tuft of hair, and this is the frontotemporal triangle, and this is the temporal framing of the face. So this area is called as the frontal hairline. Now the second area is the area of mid-scalp area. The mid-scalp area extends from this region up to the mid-coronal line. The mid-coronal line can be drawn from the external auditory canal in a vertical plane, just like that, from this ear to this ear. So mid-scalp area is in between the mid-coronal line and hairline, anterior hair line. In third case, in a third vertex area, the vertex area usually start from mid-coronal line and behind, and then the area of crown area starts. So now you can see the grading system. According to Norwood, the grade 1 usually it is a controversial. There is no any baldness or there is no any hair loss according to Norwood scale, but controversy still remain. Hairline in this grade is usually of adolescent and of juvenile type, situated in uppermost brow-crease area. At an age of about 25 years, it enters into grade 2 system of Norwood classification. In grade 2, hairline is one finger breadth behind the upper brow crease area, and frontotemporal traces appears in this region.